familiar with the Chamber of Commerce, our role is to support our member businesses and many other businesses across the county in any way that we can do to help you to become bigger, better, more productive, more positive, safer. And that's where we come in, working with Devon County Council to bring you these types of webinars that are going to be really supportive of you getting your teams back to work in the very near future. As we know, Boris yesterday announced that we are on track for with his roadmap to reopen completely by 21st of June. So it's really important that we are all prepared to get back safely. And that means looking after our teams, our staff, our customers, our clients, and also making sure that the products that we use and touch and so on are done so in a completely safe way. So in order for that to happen, we've assembled a panel of experts in this series of online question and answer sessions, which are aimed at helping businesses reopen or adjust your operations. And we look ahead to the next stage in the government's COVID-19 roadmap out of lockdown. So these sessions are an opportunity for you to put your own questions to our panel. They include experts from public health, trading standards, enforcement, environmental health, and other industry representation, including the Southwest Tourism Alliance, which is really good to have Alistair Handyside here with us today. So as I say, it's a session is an opportunity to ask questions, share any concerns you may have around operational adjustments and reopening, get the right information from the right people here. And I know that if there's questions that can't be answered here, we can take them away and we'll find answers for them back in the office somewhere. We'll find an expert for you. So housekeeping. Obviously, your health and safety and fire alarms and so on is going to be dependent on where you are at the moment. So I can't really help you with that. But what I will say is that it's good practice in these events to keep muted if you are not actually speaking. It just helps cut out any of the background noise that might be irritating for other people or disrupt their hearing of what's going on. So appreciate it if you do keep yourselves on mute. If you'd like to ask a question, there is, if you hover along the bottom, if you're not used to Zoom yet, I think most of us are, but if you hover along the bottom, there's a chat facility. And as you can see, Olivia has put a little message in there for you to put your questions in the chat. We'll be keeping a check on that so that as we go through, if you've got questions, you think of them, you can put them in that chat. You can either put them to me privately. So if you want to be anonymous, I'm happy for you to send them to me privately so that we can pose your question. Or if you're happy for the whole of everybody here to see what you want to ask, then please do send it to everybody, because there might be other people actually on the call that are not on our panel that may have an answer that can help you. So without further ado, I think I'm going to introduce you to our panel. And I think Olivia, yeah, there we go. We've got a really extensive panel this afternoon that are really going to be able to give you some input into what you'll need to do to get you back on track. Sorry, I've just seen a message. I can't see the box to check I'm off camera on mute for some reason. Olivia, could you just get back to Hattie on that, please? That would be great, thank you. So, Sarah Jane Brown. Well, we can't see you because of that we're on the screen, so we can't necessarily see you, but we will do shortly, obviously. As we get people to answer, we could possibly put spotlight on Olivia. I think the speaker would be great. Sarah Jane Brown is from Cornwall Council. She's the team leader for the COVID response team. And as you can see, she's been with Cornwall Council for 21 years, primarily working in the health and safety team, as well as with their award-winning business regulatory support service. For the last year, Sarah Jane has worked on and subsequently led Cornwall's COVID-19 team, in a range of business support and regulatory functions, including delivering over 40 COVID-19 webinars for Cornish businesses. Wow, Sarah Jane, you've been busy. It's been a very tough time, and I'm sure you've had a lot of work to do over the last year or so. Julia Chisnall, Public Health, Torbay Council, and Julia is the lead consultant for health protection, including the COVID-19 response for Torbay Council. So again, good experience there from Julia. And the next one, Olivia, thank you. Stephen Crooks, welcome to you. Stephen's the Environmental Health Officer at Plymouth City Council. And Stephen has been an EHO for Plymouth City Council since September 2008. He's currently working with the Food Safety and Standards team and has helped to produce the COVID-19 toolkit. He's a duty officer for Plymouth's COVID-19 Control Hub. Part of his role involves providing advice and support as well as enforcement of COVID-19 legislation. Hello to Stephen. I'm not sure I can see you, but hello anyway. Next on our panel, we have Sarah Desbois-Kelly. Is that how we pronounce it, Sarah?
It's Sarah, but it's fine. I answer to anything.
Okie dokie, Sarah, thank you. Senior Environmental Health Officer at Torbay Council. Sarah has been an EHO in the food and safety team for 14 years. There's a lot of experience here on this panel, I can tell you. Since the pandemic began, Sarah has had an active role in educating and enforcing COVID legislation in a wide range of business sectors. She writes a business bulletin that goes out to 4,500 Torbay recipients every week, giving advice and support about current business matters. That's brilliant. Thank you, Sarah, for joining us today. Dr. Ruth Harrell, Director of Public Health at Plymouth City Council. I think, like me, you've probably seen Dr. Ruth Harrell on the local television quite a bit over the last 12 months or so. She's been the Director of Public Health for Plymouth since September 2013, having worked in the city for a few years before that. A year ago, most people wouldn't have heard of this role, absolutely, let alone known what it was for, but most of us are familiar with this now. Sitting within the local authority, the DPH has overall responsibility for the health and well-being of the population. The main focus of the last 15 months has been trying to reduce transmission of COVID-19. In Plymouth, the Environmental Health, Trading Standards and Licensing teams sit within the Public Health Directorate and have worked together to manage outbreaks, reduce transmission, communicate the ongoing situation and what needs to be done, and to support business in working safely. Good to have you here with us today. Richard Noakes. Richard is the COVID Support Office for Sedgemoor District Council and has been working across the licensing and environmental health team since last November. He instigated the setting up of the cross-district COVID-19 team to ensure consistency in interpretation and application of the guidance and legislation. And boy, did we need that. On a day-to-day basis, he's directly involved with providing advice on the COVID-19 regulations and guidance to both colleagues and businesses. He's promoted a proactive approach to supporting businesses to reopen safely as they emerge from lockdown, which has included regular site and premises visits prior to each significant change in the roadmap. That's brilliant, and thank you for joining us, Richard, and sharing your expertise here today. Our next panelist is Lee Taylor, who's the Trading Standards Officer for Devon, Plymouth, Somerset and Torbay. Lee has been TSO since April 2001 and works within the business support team. He provides bespoke trading standards legal compliance advice to businesses. Part of his role involves providing his interpretation, advice and support to businesses on COVID-19 legislation, and he's also contributed to the COVID-19 toolkit. Thanks for joining us again, Lee. And finally, a real pleasure to introduce you Alistair Handyside, MBE, who is the chair of the South West Tourism Alliance. And obviously that's very focused on this sector today, looking at how we get back safely. Alistair's chair of both South West Tourism Alliance and the Professional Association of Self-Caterers Limited. He owns the award-winning Higher Wiscombe Holiday Cottages with his wife Lorna. In 2021, they won Best Self-Catering in the Visit Devon Tourism Awards. Sorry, I'm going to get my teeth in. and the Southwest Tourism Awards. Alistair was instrumental in the establishment of the Southwest Tourism Alliance, believing a unified voice for the Southwest was critical when lobbying for the region, and that some key services could be maintained by the private sector. Alistair has previously held roles as the chairman of the Southwest Coast Path, chairman of Premier Cottages, and is currently a director at the National Tourism Alliance. He's also chairman of the East Devon AONB. Alistair was awarded the MBE in the June 2018 Queen's Honours List for services to tourism in the Southwest. Wow, quite a background then, Alistair. And I suspect that if you don't know the answer to these questions, then nobody will do. So thank you very much for joining us today. I think with that, you're going to stop hearing my voice. I'm going to hand over to Alistair to say a few words and introduce himself and say a few words about the situation and your perspective on getting back to a safe working environment for all.
Helen, thank you very much for that, and welcome to all of the participants, and hello to all the panelists. Right, Southwest Tourism Alliance, WHO, it's a virtual group of people who want to work together. It would be the visits, Visit Devon, Visit Cornwall, Visit Somerset, Visit Dorset, English Riviera, Destination Plymouth, and many other partners work together to try and make sure that the Southwest doesn't lose out when it comes to decisions made up in Westminster. Obviously, that's become increasingly important over the last year of this awful crisis. Give you an example of what we do. Since the beginning, since March the 23rd last year, we have sent out a weekly newsletter giving all the guidance, all the updates, all the law changes, all the rule changes. So this week's one, which I write on a Friday, will be issue 57. That gives you an example of how long this awful crisis has gone on. And it's relied upon by people as a safe source of information, very careful what we put in it to make sure that it's correct. We're also working in that same group on a plan which 6 months ago was initially called a recovery plan. We're moving on from recovery now. We don't want to use the word recovery. We think the government will see that hospitality has a very good summer and will think that we don't need to recover. Well, all of you out there will know just how much you've lost over the last 15 months. So we've slightly nuanced the language and we're calling it Towards 2030. It's a plan that will try and deal with the market failures that have occurred in the region, which have been highlighted by the COVID crisis. And it will include things like resilience, making the hospitality sector more resilient. One of those things will be trying to push forward for safe and legal compulsory registration for hospitality businesses to try and make sure that it's better regulated. We'll be looking to try and help with the region's objectives on getting to net zero with a sustainability campaign, working on productivity, working on skills, trying to make the Southwest the preeminent region in the country for accessible hospitality, and much more. And that plan will shortly be able for people to read and review. It's being signed off by the funding partners. The funding partners are the three LEPs, Cornwall and Isles of Scilly, Heart of the Southwest LEP, and the Dorset LEP. So as you can see, we're trying to work on a regional basis. So what's happened this week? We've heard for sure that we will on Monday, the 17th, be able to open up a lot more of hospitality, by no means all of it, but a great deal more than we've been able to open up now. This is part of the government's gradual opening up campaign to try and suppress the virus. Whatever your views on that, we are in a situation where the virus is at its pretty much lowest ebb for a very long time. So what I'm going to sort of say to you all is the most important thing that we can do as a sector is to make sure that we keep doing the COVID preparation for our businesses, the COVID secure operational practices. It's important for two really fundamental reasons. One is it will actually help suppress the virus, and we really don't want to be looking at another lockdown from a third wave. And although all the evidence suggests that hospitality is not a spreader, the government seems to think that it is. Otherwise, we wouldn't be the one area that gets permanently closed down. So we really do need to do this. The second thing is customer feedback. We have taken, you can imagine in my job, writing the self-catering cleaning protocols and being chair of South West Tourism Alliance, we couldn't have any of my customers ever saying they didn't find the place spotless. We're finding that the feedback on that is absolutely astonishing. The fact that they can see the COVID secure precautions being made for their benefit and for their safety is absolutely a selling point. It's a really good selling point. I mean, cleanliness is next to godliness in hospitality. You know, the clean businesses will always do better business. Doesn't matter whether you're 1-star or 5-star. All businesses should be 5-star clean anyway. So this is just taking that, you know, one step further. The feedback we're getting when businesses are good is fantastic. I can also show you the emails we get from the general public when they come across a business that isn't following the procedures are high volume when they come through. That's the politest I can put. So customers expect us to be keeping them safe. The opening up of the guidelines, I'm not going to run through every single guideline that's been opened up, but essentially we can go inside again in small groups. Depending upon whether you're having a wedding or a group, it might be a different number. It's essentially rule of 6, which can be from 6 different households, or 2 households if you wanted to have, you know, a family of 5 and a family of 4. So it sounds complicated, but it's actually quite easy. Anybody wants any clarity on that, ask away. This gives us a chance for the first time since November the 2nd that a family, for example, can holiday with their parents, or you can go on holiday with someone you haven't been in lockdown with, or you can go to the pub with somebody you haven't been in lockdown with inside. You know, this really is a big opening up. It's still socially distanced inside until June the 21st. Announcements are made. We're not sure precisely what the inside rules will be, but you can go inside. And looking at the weather outside the door, you know, from Monday, this is really going to help a lot of the hospitality businesses and help people have a good time. So please, you know, whatever questions you've got on any of the rules on opening up, or any of the cleaning protocols, or any of what you think will happen next, you've got a panel from heaven to ask. So please bang your questions in, ask any of us. If we don't know the answer, we probably know someone who does, so we'll be able to get you the answer. So without further ado, I'm going to say I wish all of you the very, very best in getting to a more economic version of trading from Monday, and keep working as hard as you can at that so that we can get to full opening on the 21st and try and get back to profitable trading then. So I wish you well, and I'm happy to take any questions when the panel opens up. Thank you very much indeed.
Thanks very much, Alistair. That's really some heartwarming news as well, because it's great to look forward to 2030. I think that looking forward, being positive, is the only way to move and progress now. You know, we've had a torrid time, particularly in hospitality and tourism over the last 12, 14 months. But now we're coming out of it. We have to be positive and look at how we can, as you say, become more resilient. I was interested to hear a lot of what you got to say, because it correlates so much with what the Chamber are trying to work on as well. There are so many priorities that we obviously have in common. Skills, for example. I'm leading on behalf of the Greater Devon, with Devon Plymouth Chamber leading on it, but with colleges and other big stakeholders, to put together a local skills improvement program, which is a trailblazer program, which we're bidding for at the moment, and really be focused on employers, be looking at what employers want and what they need. So as we come out of this COVID situation, the skills arena is going to be changing quite considerably, and the sort of people and skills that you're looking for may well be different to those you've had needed before, particularly when it comes to digital and technology. So it'd be great to keep those conversations open so that we can feed that into our plans. The carbon neutral agenda, the green economy, that's something else that we're very much leading on with regards to businesses of all sizes across the county, and the LEP area. So great to work with you on how we can support you within local tourism hospitality settings as well. And I think the resilience thing, it's about thriving, not just surviving. As I said, we need to look forward. And generally, the Southwest is in a great position. With tourism being the springboard, I think, over the summer, that's going to be, every sector of business is really going to be looking at tourism and hospitality to support their own businesses in many ways that you can't imagine, because of that leisure facility aspect that's going to be really, really crucial for people as they come out of lockdown. But also the Southwest is currently attracting lots of new innovative businesses. Now that people realise they can work remotely, they don't need to be in the centre of London or Bristol or Birmingham or whatever. People are beginning to relocate down here. We've seen the housing market start to go through the roof. But what it will do is bring new opportunities, new markets for tourism, hospitality and leisure. So that's to be welcomed as we move forward, and obviously will help us towards your 2030 ambitions. So I'm going to open up the question and answer session now. We've had a couple already in the chat, so I'm going to go for those first of all. So Kathy says, oops, I've lost it. Where's it gone? Sorry, I've lost the chat. Just bear with me a moment, as soon as that went. Kathy says that she's opening up a new business soon. And is there any advice? What I will say from the Chamber's perspective, Kathy, is that we've got a small business toolkit. We work with lots of other businesses that are giving a lot of advice and support for new businesses generally. But Becky has come back on that and given you an answer there with business advice supports. And obviously the Growth Hub is a great place to go for new advice. Can I open that out though to our panelists? I'm sorry, Olivia, could you just put it onto gallery view, please? Because I can't see any of our panelists raising their, that's it, thank you. Just so that I can see the panelists, that's great. And then I can see the chat at the same time. Brilliant. So is there anybody wants to come back to Kathy on opening a new business, particularly obviously in the sector that we're concentrating on today? Just unmute yourself and shout, I think might be the best way at the moment.
I can make a start. Sarah Jane in Cornwall Council. Don't really say what sort of business you are or where you are. And, you know, there's a huge amount of resources out there. I mean, you've got quite a lot of local authority experts here, and each local authority would be more than happy to have a chat to you if you're starting a business in their area. Certainly in Cornwall, we've got a business regulatory support team. That's free to contact, telephone or email. I'll put the details in the chat, and they can give you advice across the regulatory field. If we're looking specifically for COVID advice, the government website has got a lot of really good information, including the Working Safely guidelines. Health and Safety Executive have got information on how to do risk assessments, COVID risk assessments and general health and safety. But I would say really get in touch with your local authority, talk to them about what registrations you might need. Do you need a food registration? Do you need planning permission? Any help like that to start off with. And then there are so many organisations around, Federation of Small Businesses, Growth Hub, that really are out there to help with start-up businesses. So any specific information, it might be useful if you sort of tailor down what exactly help you're looking for.
Brilliant. Thank you very much, Sarah Jane, for that. Kathy, would you like to just give us a little bit more information, a bit more detail on exactly what it is you're looking for and what your business is, where and so on?
Yeah, hi, can you hear me?
We can hear you, yes, thank you.
Oh, hi. I'm actually reopening Oldway Mansion. I don't know if you know of Oldway Mansion.
Not personally, no.
No,
Yes. It's in Torbay.
yeah.
Ah,
You'll know, Sarah.
I do, yes.
Yeah, we're actually a charity, and we're reopening the tea rooms in Oldway Mansion, which in Torbay is very, very big news. We're ready to go. Apart from our disabled toilet that's not quite finished, it's a long story. I'm very experienced in the catering business, so I'm fine with environmental health, and I'm fine with registering the business, and we are a council tenant, so we're fine with all of that and everything else. And don't please talk to me about planning permission, because listed planning permissions are a very painful process in a grade 2-star mansion. What I don't know about is COVID. I have not worked all the way through COVID because I was furloughed as a chef last year. And as we're brand new, and I'm going to be working with all volunteers apart from myself, I don't know where's the best place to go for the COVID advice. My EHO has given me some advice, but we kind of feel like we're not really prepared for it.
Kathy, I'd be happy to come and meet you.
Oh, that'd be great.
At Oldway. I could meet up with you, and if you privately send me your details, your telephone number,
yep,
and I can call you after this, and I'll arrange to come out and meet you at Oldway.
Oh, that's fantastic. Thank you.
Go through what you need.
That's lovely. Thank you very much. That'd be brilliant.
Okay.
Thank you.
So from public health perspective in Torbay, welcome. We've jointly worked with environmental health to do little action cards and things, so to help you prepare, and also what to do to respond if you get someone with symptoms or testing positive who's staff or visitor. So we've got that side of things as well, and we work together to support you.
That's brilliant. Thank you so much, Julia and Sarah, for that. That's a really good offer. And that's the kind of thing that we're here to do today, is to give some actually direct help for you as individuals. It's not just generalized, although that always helps. You know, we're here to help you as individuals for your own businesses. So thanks, Kathy, for that. And I'm very confident that Sarah will be able to support you and make sure that you can open safely. That's great. So I've got a message from A Wanda about having difficulty finding out if it's permitted for a private chef, yoga teacher or beauty therapist to provide indoor services to guests with more than one family in holiday cottages. Is there somebody who would like
to do that one, Helen?
Yeah, please, Alistair, thank you.
Right. This is the kind of question that I get as the chair of the Professional Association of Self-Caterers about 30 times a day. It's a sort of detailed interpretation of the guidance. And bear in mind, a lot of it is guidance. I'm not saying go ahead and break the law, but you know, a lot of it is guidance, and you need to nuance it and understand what they're trying to get at. So what they're not trying to do is for you to have a yoga session for 65 people inside. However, a private chef or a yoga teacher or a beauty therapist is able to go to work within the guidance. If you went to a yoga teacher's facility, you'd be able to have a yoga lesson. If you went to a beauty therapist, you'd be able to have a beauty therapy. You can have your nails done. You can, you know, have your eyebrows done again, and all of the scandalous things that they stopped you doing before. So I would say that the answer to that question is yes, but there's always a but. You must do a risk assessment on these things. You absolutely need to make sure you are risk assessing these things and doing them in a COVID secure way, so that the private chef, for example, he can prepare the meal, and he can do it in a way where he doesn't come any closer than perhaps somebody would come when they're serving your meal to you inside in a pub from Monday. So the risk is no greater than it would be if you were having the meal served in a pub, and then he wipes everything down. The same with the beauty therapist. She can do the treatments, but she doesn't need to be in contact with anybody else who's not having the beauty treatments. So if you apply, you know, some basic rules like that, I would suggest that you would be able to have those services inside your. I have a self-catering property. We will be able to go to 2 households next week, and they are asking if a chef can come in. And as long as the chef complies with those guidance that I've just given you, I have said yes, because they could go to his pub and go inside his pub and be cooked for there, and he could bring it out. So I would probably suggest it's safer even here, because there's less people going through. So again, risk assess, take care, and make sure your customers know how they have to play their part in complying with all of this.
Thank you, Alistair. That's really, really helpful. And Jason Berry, thanks. You've put in the link to the Heart of the Southwest Growth Hub Risk Assessment Toolkit. So I've seen that before, and it's really, really easy to follow and very comprehensive too. So I would recommend you look at that. And thanks, Olivia, also. You've put the Small Business Toolkit link into the chat. That's our Chamber's Small Business Toolkit that's been subscribed to by lots of other businesses to support you every step of the way through not just brand new startups, but if you're a fairly new business or just moving on to the next level, there's a lot of really good support and advice in there. Does anybody else want to come back on that question about chefs and yoga teachers and so on? Anything else to add to that?
Helen, while they're thinking about that, if anybody is a self-caterer out there, if they send an email, and I'll give you the email address in the chat, you can get a free newsletter every Friday, which is dedicated to the self-catering sector, that puts all this kind of information in every Friday afternoon. And then there is the Pask UK Facebook site, which updates any kind of regulation changes, rule changes, whatever, and they're free. You don't have to pay for the newsletter. It comes out free to any self-caterer. So I'll put a note in here about my email address. You just send a note saying newsletter, we add you to the list, and you'll start getting it from Friday.
That's brilliant. And things change so quickly that those kind of weekly updates, monthly updates are so important. I know we get lots of updates from local authorities and British Chambers of Commerce and so on, and they make such a difference because and the clarity as well of the guidance, as was referred to before. The clarity is not always there within the guidance. It's how they're interpreted. So if somebody that you know and trust can do that for you, then that's really useful, really worthwhile. Did anybody else want to come back on that point? As Alistair covered it all? Nope, that's great. Thanks very much. So I have got another question here privately that says, from the 17th of May, if we were to use our marquee as an outdoor space, which is less than 50% enclosed, would we be able to have groups of 30?
I'll answer that one.
Thank you, Sarah.
The answer is yes, you can. It would be considered an outdoor space if it's less than 50% enclosed. So you could have groups of 30 in there. I suppose if you're holding a function, you just need to think about ventilation of the area, which hopefully it would be well ventilated. It's less than 50% enclosed. And also, if you've got groups in there, social distancing as well, but that would be acceptable. I suppose the flexibility with an outdoor space like a marquee is you could have it as an indoor space as well, depending on the weather. And obviously, if it was an indoor space, then it would be the rule of 6 or 2 households.
Right, yeah, that's great. Anybody else want anything? Got anything to add to that? So, what's happening with, or what do you think was happening with masks in those sorts of situations? Do we think that, just social distancing, mask wearing and so on, how's that going to impact people while they're socialising in your venues?
There is some guidance out from the government that talks about what to do in terms of social distancing, and thinking about who's in your group and whether they're vulnerable, whether you should be giving them a hug or not, or staying away from them, or wearing face coverings. And I'll put a link to that actually in the chat as well.
Thank you. So yeah, so it's really it's discretion, it's common sense, thinking about who you're with, as well as where you're going. Lovely.
Just note, it is still a requirement to wear face coverings in indoor settings.
Indoor settings.
So obviously, when they're consuming food or drink, they don't need to. But if they get up from the table to go to the toilet, then they will need to put a face covering on. If anyone wants any more clarification on that, that's fine. But I think we all know that you still need to be promoting the posters. Please wear a face covering, encouraging people to wear them, obviously in a non-aggressive way.
Absolutely, yes, yeah. Yeah, absolutely. But I think with the Marquee example, you know, it's sort of an outdoor space, but if it's only 50% covered, are the rules the same within that Marquee as they would be indoors? Yeah.
So if I don't know if Sarah wants to elaborate anymore, but with the marquees, you just need to be careful that they're 50% open or more if it's to be classed as an outside space. If there are movable sides on that marquee, it's not classed as open, so it'll be enclosed. So you need to be quite careful about what your perspective of that shelter is. What's it there for? Do you want it to be an outside space or not? If it is an outside space and more than 50% open, then you wouldn't have to wear the face coverings in that space. However, the separation controls between different parties, different households, needs to be maintained. So that's part of where the 1 meter plus comes in. So it's part of, it's something for the business operator to consider as part of their risk assessment and how that's going to be managed responsibly.
That's brilliant. Thanks so much, Stephen. Yeah, I think that's clarified that for us. Anybody else want to come in on any of that? No? Brilliant. So I have another question here about staff, actually. So I have a member of staff who was advised that they've been identified as clinically extremely vulnerable. Can they return to work? And if so, what do I need to do? What do I need to have in place in order to make sure that they're safe?
Shall I deal with that one?
Thank you very much, Stephen. Yeah, go ahead.
So the guidance for clinically extremely vulnerable people has now ended. And everyone should now follow the rules for what you can and cannot do, which is published on the gov.uk website. Staff should continue to work from home where possible, and employers should take reasonable precautions to support that. If it's not possible to work from home, then they may return to the COVID secure workplace following your risk assessments. But the employer still has a duty to take account of vulnerable people and to implement reasonable measures, having regards to things like the doctor's advice and the fit note, which may help you consider reasonable precautions. Ideally, employees should be involved in the risk assessment process and help to identify risks, which can help them consider reasonable precautions, measures that can help protect staff should be clearly communicated to all employees and should also help to alleviate their concerns over returning to workplace when they're involved in that process.
Brilliant. Is there a particular risk assessment template that can be used for some smaller businesses? Because I know, you know, from my own experience that sometimes smaller businesses don't have these risk assessments necessarily in place written down, and sometimes reliance on sort of templates from respected organisations does help.
So there is a template in the BBFA toolkit on the COVID risk assessments section that's been provided. So there is a template in there. If they have less than 5 employees, it doesn't have to be a written risk assessment, but they still need to do one. Part of what they need to consider is what is the risk of coronavirus? How does it spread? So airborne transmission face-to-face and also on surfaces. And then consider how people come to your workplace and how people interact at the workplace, and use that as the basis to understand what the risk factors are. So it doesn't have to follow any stringent process, doesn't have to follow the guidance in the toolkit that we've provided, but you need to do a risk assessment. And where you identify risk factors such as potentially staff members who are clinically extremely vulnerable, you need to take account of that. And if you need any help or support, then your local authority could probably give you a bit more guidance as well. But there is plenty of advice for different sectors as well, for working safely on the gov.uk website. So that would be very useful if you're, say, in a restaurant setting or something like that.
Perfect. Brilliant. Thanks very much, Stephen. So we'll move on to the next question then. How likely is it that we'll see a surge in cases over the next few months? And what might this mean for the sector, for the tourism and hospitality sector? I wonder whether, Ruth, you might pick up on that one.
Yes, of course. And this is this is a really interesting question at the moment, and we have to remember that what we've done with COVID is suppress the rates. It hasn't gone away, it is still there. And those of you who are following the rates might notice that at the moment we have a little bit of an increase at the moment in Plymouth and also in South Hams area. So it hasn't gone away, it is very much still there. And this is why we're trying to have a really balanced approach. So the really positive news, of course, is that the vaccination programme has rolled out so well. And of course, the people that have been vaccinated are those that were thought to be most likely to end up in hospital and potentially to die from this disease. So that's all very positive, and that's why we're now at the point of trying to open up again. But we have to open up a little bit cautiously, because there's a large proportion of the population, of course, that haven't been vaccinated. And we know that the rates are easily rise in the working age population, the younger working age population in particular. And so there is every chance that we will start to see these little rises. And that's what we've got at the moment in Plymouth. We've got a small rise. We know why, we know what's going on there, but it is taking us above the national average, which is unusual for an area in the southwest at the moment to have proceeded to have elevated above the national average. And this is the position we find ourselves in. So we know that there's harm from COVID. Now, we may have reduced the proportion of people that might be hospitalised with it, but that isn't to say that COVID itself isn't harmless. It certainly can be quite nasty for younger people, can lead to long COVID, etc. And there are still risks that people will become more seriously ill with it, just at a lower rate than older, more vulnerable people. So those risks are still there. So we can't just say, oh, let's just let cases run riot. But on the other hand, of course, keeping businesses closed, that does harm to the public as well. That does harm to the population. There's nothing better for your health than having a good job in the long run. So we also need to get the economy going. And that's why what we've got to try to do is balance this approach. I'm sure we will see points where the cases are rising. I'm sure that many of you, if you haven't already, and some of you will have done, will have to deal with the knowledge that there may be an outbreak, or there may be, linked cases that might have visited venues and may need to track them down. And we all need to keep going with the guidance as much as possible. And it may well be that the public perhaps relax a little too much. That would be of a concern. So asking the public to risk assess could mean that we go a little bit too the wrong way and we do start to see cases rise again. If we see that happen, then you'd expect to see some of the press conferences coming back that are painting a little bit more of a darker picture. And it is going to be a balance. We're really hopeful that because we're going into summer, people are more likely to be willing to meet outside, keep their rooms ventilated if they are indoors. These things are so important for limiting the spread. So we are in a bit of a race to try to get enough people vaccinated so that we're safe when we come into winter. But I think we can expect it to be a little bit turbulent over the next few months, definitely, and lots of work for outbreak investigation and yourselves. So we mustn't expect an easy ride of it, but hopefully we're at the right point. There is a little bit of a wild card in that, of course, and that's the new variants. At the moment, we know that, or at least we've got reasonable evidence that the new variants that we're aware of aren't likely to significantly break through the vaccination. So we think the vaccination programme is still going to work for them, but we don't know what else might come in. So there is that wild card in there, which we hope we won't have to deal with, but we hope that the variants we'll see will all be managed to be controlled by the vaccine. So I hope I've given you a reasonably positive viewpoint, but we mustn't get complacent, but we also mustn't be too alarmed if we see these sort of smallish increases like we're seeing at the moment in Plymouth.
Thank you for that, Ruth. Yeah, you're absolutely right. I live in the South Hams, and over the last week or two, I've been seeing that creep up. And yeah, it does make you feel a little bit concerned. And I can understand exactly what you're saying, how everybody must feel when you see it sort of just getting up. And it's not been at all. We've been way below the national average the whole way through. Yeah, we have to be pragmatic about it, I think, and just continue to look after ourselves.
We do, and it's often a small number of cases that can make it suddenly look high. So it's we've got to balance the not being alarmed with it giving us a bit of a reminder that we do need to be very much aware that it is there and that it spreads easily.
Yeah, and conversely, I think, you know, where cases are very, very low, I think you're right to say we mustn't be complacent. And just because, as I say, in Southampton and Plymouth, we've been very, very low for a long time. Yeah, just a little bit of complacency and it can go the other way. Is anything anybody else wants to add to that? I think it's a very comprehensive answer, so I'm not sure what else we can add. But that's brilliant. Thank you for that.
Helen, I'd like to say, if you know, from a hospitality point of view, we want to make the point that if we're going to suffer any further restrictions and closures, having had the last 15 months that we've had, that it genuinely is evidence-based. I mean, there's been all kinds of court cases against the government about the lack of evidence there's been about hospitality causing the spread of COVID. You know, that's what it may be, but if it's going to get closed, again, it needs to be evidence-based, and there needs to be support for those businesses. I did a survey under the heading of the Professional Association of Self-Caterers about how many got grants, and not enough of the businesses out there are getting grant support, and that's a problem that needs to be addressed. And the second thing is, we asked a question at the end, which was a voluntary question, because the amount of calls I get referring to mental health have been growing and growing and growing throughout this crisis. So we asked a question that they didn't need to answer at the end, but bear in mind at the beginning, to make sure it was real evidence that we could use about grants, they'd given their name, their telephone number, their email and their address. 46% admitted to having suffered what they would call mental health issues over the last 15 months. So the damage when you close businesses is not just economic. And I can tell you that probably 5% of the businesses in my little sector called self-catering will not open again because they don't have the confidence to just do it. They have lost the ability to do it. So that will have a secondary economic impact. They may not be closed, but they'll never open again. So we would say, absolutely, you know, we'll do what we can to keep everybody safe, but you have to work with us too to make sure it's evidence-based. And if we do have to close, you support us on getting the support that the businesses watching this need to get to survive. So that's our view on it.
Yeah, absolutely, couldn't agree more. So Ruth, you wanted to say something?
I was am I muted? Sorry, I was just purely going to say absolutely. I understand there's been a huge impact on many businesses of COVID. It's been awful for everyone, and completely understand the points that you're making. It's a really difficult situation. Obviously, I've said that public health does completely value you know, the fact that we need a healthy economy, we need people to be able to work in the jobs, we need good jobs for all people. So I do understand that point exactly. And absolutely, you know, the businesses should have been recompensed for the hardships that they've faced. So absolutely understand the points that you're making there.
Thank you.
Yeah, absolutely too. I know in our village, we've got 2 pubs. One of them's got a fairly decent sized garden, so they've been able to open, and they were doing delivery, home delivery meals as well during lockdown. They've been able to open and just about on a skeleton staff managed to make ends meet by doing some outside catering. But the other pub just doesn't have the facility to do that, and it's not been worth them opening at all. And at the moment, I'm not sure whether they will open again at all. And yet it's been one of the top pub restaurants in the whole of Devon several times. Just don't know whether it's sustainable, apart from the fact that some of the staff have gone off and got other jobs and doing other things. So, you know, it has so many connotations, so many different impacts. Yeah, it's had. So thanks for that. Yeah. Just got, oh, sorry, Julia, would you like?
Going to add on the mental health point, really. I think we're in Mental Health Awareness Week, aren't we? And you're right that if you're not financially solvent and you haven't got your job, those are the most important things. But we can also try and support people in terms of, you know, building resilience and having a workforce that talks about issues and isn't afraid to say, I'm struggling. And we really want to work with people on, you know, workplace well-being and really helping to address a massive deficit that we've got, I think, in terms of resilience wellbeing in so many sectors, and that's something that we can all do a bit in, but where we can also put out support and resources and training and so on to help.
It's a really, really good point. Thanks, Julia. Yeah, we mustn't forget mental health in all of this. It's had a huge impact on all of us one way or another. Thanks. Yeah. I've got one more question then before we move on. And it's actually quite a fundamental question, I think. What details are we required to take for the purposes of test and trace? Is it just the lead member of the group, or should we be taking details and information from everyone in the group? Alistair, do you want to come in there?
Yeah, this came out really late. It was lead booker for a while, and then about a week before we reopened on the 12th. It's very clear in hospitality. It's everybody's contact details. It's not just the lead booker. So if you're a hotel and you're going to have a family coming next week, everybody over 16's details, email or mobile telephone number or QR code. It's obviously very difficult to track the QR codes. Sometimes when you go and watch the way people are entering premises, there's an awful lot of people don't seem to have phones these days when they go into premises, because they don't want to do the QR code. So again, this is a message that we need to be getting out there with the marketing, that the public have a part to play in all of this. Confronting somebody who's on less than £10 an hour saying, I don't have a phone, and making up a phone number isn't particularly helpful. So businesses can't double check the phone number or double check the contact details. So you have to display a QR code in your premises, in your hospitality premises. That is the law. They're easy to download. If you Google hospitality QR code, it'll come up, and it's a piece of cake to get one. It takes about 5 minutes, or less than 5 minutes of your time, but it takes about 5 minutes for it to come through while they verify. Very efficient. Guests should check in every single day and check out every single day. That's not going to happen in most cases. So if you're an accommodation provider or hospitality provider, make a list yourself if you can. Certainly with hotels and overnight accommodation, you have booking software, most of which has been adapted to help with this, or you have to write down their names by getting the guests to send you in their details. It's painful, but it's all part of being able to try and, when we hear these Indian variants and things like that, if we got a call, how else would we track these people down if we didn't know where they'd been? So yes, it's a pain, but it is a requirement, and it's all guests, all people sitting at the table over 16.
Thank you. Yeah, absolutely. I think it comes down again to somebody mentioned earlier about personal responsibility of the guests as well, and somehow or other we need to get that message out to everybody, their responsibility for themselves and for others in this. And whilst the onus is obviously on the sector, we need to make sure that our guests are fully aware too. Thank you. Anybody else want to comment on that one? Alistair, I think is.
Yeah. So thanks, Alistair. That was great. Just to include on that yes, it is a requirement for the QR poster to be displayed, but some people may not have access to a smartphone, so that information will potentially need to be taken in a written format as well. And you just need to be aware that GDPR, the General Data Protection regulations, will apply to how you're obtaining that information. So you shouldn't have, say, a logbook where everyone just writes down their name and contact details in that book, because the next person who comes along will be able to see it. So you need to be aware of that and the requirement to maintain that information for 21 days, and that helps to support the test and trace facility. So if someone who visited one of your premises turns out to have tested positive for coronavirus, certainly if there was an outbreak, then obviously we would be able to get in touch with you and get those details and help stop that from occurring. If
you can hear something we can't, I think.
Me? All right. Okay. I can hear someone speaking. Yeah. I hope that helps to answer the query based on the fact that some of the things that we see quite a lot is in terms of the recording of written information is that doesn't necessarily comply with GDPR, which can open you up for various fines. So if you've got any queries on that, then obviously now would be a good time to raise those further.
Yeah. So Stephen, we have in our office, we've got a standard visitors book, which it covers off all the personal details, so you can't actually see who's written anything before. So something like that would work.
Something like that would be fine. A card where they can fill it out and hand it into you at a reception or something like that. Staff should be authorised to check that information, just so long as you've got secure procedures for it. But yeah, where the new member can't see whoever else is checked in and see their phone number and everything else. Otherwise, that will open you up to fines.
Yeah, absolutely. Yeah, don't want that. That's brilliant. Thank you for everybody who's put all the information in the chat. As Jason says, we will be sharing that with everybody afterwards. So, you may want to take note of it now, but definitely you will be getting all those links, all that information in the post-webinar email. I suspect it will be from Jason Berry. Thank you so much to our panelists. It's been really interesting. And we'll pick up on it all again in a week or two's time. In the meantime, we're just going to hear from Kerry Ross from the NHS about an initiative that the NHS are running to help try and keep people safe, actually, within your settings. Thank you, Kerry.
Thank you. Hi, can you hear me okay?
Yes, thank you.
Great. Hi everyone, so I'm Kerry Ross, I'm Senior Communications Manager for NHS Devon Clinical Commissioning Group. And one of the big projects that I'm working on for this summer, well, the bank holiday coming up and the rest of this summer, is making sure we can target tourists and visitors when they're in Devon this summer to make sure that they know how to access NHS services while they're here. And that's really to make sure that people use the right service for whatever their need is and try to ease some of the inevitable pressures on our very busy hospitals and healthcare system. So I've just got a few points I was just going to share with you really quickly, just so you had an idea, because I imagine as business owners, hospitality venues, other places like that, you are probably quite likely to be asked for advice by some of your customers if they need medical advice while they're here. They may come to you and ask where the nearest GP practice is, or the nearest pharmacy, or the nearest hospital, or nearest minor injury unit, anything like that. And what we wanted to try and do is reach reach visitors via businesses this summer to just make the messages as simple as possible, really. So I know it can be really confusing to know which NHS service is the right one for your needs. And, that's either as us as residents of Devon, it's not just visitors, but as residents, and especially for visitors to Devon who are even less familiar with the local services and what's available. So with the anticipated increase of visitors this summer, we're just trying to prepare for that as much as possible. And like I say, as a business, you may be approached for advice by your customers. What we really want to try and get across this summer is that you don't need to worry about knowing where the nearest pharmacy is and if it's open and if they can treat this thing that the customers come to you with, or you don't need to worry about where the nearest emergency department is and if it's the right place. Or you might work in a town where there's a minor injury unit, but it's temporarily been closed over the last year and you don't know whether it's open or not. It's there's all these different things, and we just want to try and reach people to say that you don't need to worry about any of that this summer, that there's just one number to remember, and that's 111. We're really trying to direct as many people as possible, residents and visitors, through the 111 service. And that just makes the messaging so much simpler in terms of signposting. And 111 can arrange anything, really. If it's an emergency, people should still call 999. But even if they call 111 and it's emergency, they'd still be directed and an ambulance would be sent if that was what they needed. But most importantly, and I think what people feel safer knowing about 111 is that if someone does need to be seen in an emergency department, 111 can arrange that. They'll tell them when the nearest one is, and they'll make sure that the emergency department's expecting them. They'll give them an arrival slot. They can also do that with minor injury units, and they can do it with GP practices as well. So 111 can not only give advice and signposts, they can also arrange for people to be seen in the right place, and they can confirm that that place is definitely open. They can confirm the address details and all of the other things that people might need to know. So like I say, if you're approached for advice, just advise anyone to call 111 really if they need urgent advice this summer and they're just not sure which is the right service for them. 111 can also give people self-advice. They might not even need to be seen in a service, or they'll tell them where their closest pharmacy is and confirm if it's open or not. So we're going to have a big NHS campaign this summer, and we're going to really try and reach visitors through bus advertising, outdoor advertising, the kind of busy traffic routes into Devon. We're buying up advertising space on some of the train routes before you even get to Devon. We'll be looking at things like at the service stations and road signs on the motorway. We're doing targeted advertising on social media, radio advertising, all the kind of standard campaigning. But we're also looking at opportunities to send out printed materials to businesses to use if they wish. And we'll have just a new 111 campaign. So there would be, posters or business cards, whatever your business would want really. And if there were places you'd want to hand that out for accommodation owners, B&Bs, places like that. If you do printed welcome packs, we've got materials if you wanted them. We'll be looking at that. Or if you do email bookings and do kind of things that you need to know before you come, we can share materials for that as well. We've got lots of things. We'll basically provide whatever businesses and services would find helpful and what they want this summer, so that we can reach as many people as possible. So I can put my contact details in the chat, but if you would like something or you'd find something helpful, then I can share that with you. But we'll also use some of the bulletins and channels and newsletters that the councils have with accommodation owners and hospitality venues and things like that to get those messages out as well. And we'll also just be promoting the NHS app and a local app that we've got in Devon as well, which provides advice on common childhood illnesses, just to help make that kind of as easy as possible. And people don't even necessarily need to ring 111. They can get a lot of advice about symptoms and conditions from the NHS app. So like I say, anything you need to remember, and if you can share it with your staff as well, if they are approached for advice, all people need to remember is to advise people to signpost them to 111. And you can either ring 111 or go on 111.nhs.uk, and we'll follow that all up. But I just wanted to kind of share that as a key message for this summer, really. And that's me.
That's brilliant. Thank you so much, Kerry. I forgot to unmute myself. Honestly, it's so reassuring and refreshing to be told about something that's so simple, straightforward. When so many complex guidance and trying to actually interpret all those guidances they're so complicated. Having something as simple as just call 111 is going to be amazing. And I think your challenge, as you say, is to get it out across to everywhere so that people can see it. If there's anything we can do at the Chamber, if you want to send some information across, we can share it out with all our members, most definitely. And spread it out the field. We'd be very happy to do so. If Olivia puts her email address in there, send it to her, then she can make sure we spread the word.
Thank you.
Excellent. So now we're going over back to Jason. Jason, as you probably know, leads on Buy with Confidence for Devon County Council. And he's got some very good words of advice for us all here as well. Thanks, Jason, and over to you.
Super, thanks, Helen, appreciate that. Kerry, it's taken me about 7 years to get 118 out of my brain from those adverts. And now I've got 111 in my brain. Thanks for that.
Well, you'll be 2/3 of the way there.
I'm going to sleep this night tonight, seeing two men running around in joggers or something.
Oh. You're showing your age there, Jason.
Thank you very much. Yeah, I am indeed. So this isn't my project, and my colleague Denise can't be here today. So she's given me some words to read out. So I'm afraid it will be a bit like that. But it's basically asking how we can help you, really. So Buy with Confidence has sponsored this event today, and it's a marketing brand, a tool, a trusted trader scheme run by nearly 60 local authority trading standards services around the country. It's been running for about 20 years, a very successful national scheme supporting local businesses that can hold themselves out to the public as being trading standards approved. So I'll put the link for Buy with Confidence in the webinar email when it comes out to you, so you can look at what that actually means and what it does. But Devon's done something a little bit closer to home than that. It's Made in Devon has been produced as a pretty much Made in Devon marketing tool. It's a buy local initiative, encouraging local businesses who are proud of their Devon roots and are keen to show what sets them apart from other businesses. And you can join the scheme, and I'll put the details in the email as well for you. The vision for Made for Devon is to be a major household name, building on the new buying habits that emerged in 2020, and you may appreciate with all the shops going empty of toilet roll and pasta, lots of people bought local and have continued to do so, supporting their local businesses. And that's what Made in Devon are trying to continue to create over time, and to step change in the way the public views and buys local products. The tide's already turning, like I've just mentioned, due to the pandemic, which has been talking about for the last hour or so. So if we can help our businesses sell their products by marketing Made in Devon, that's exactly what we want to do. Now, why we're here today is to look at how we can support the hospitality industry. And we understand the holiday accommodation tourist venues are going to be, well, we think they're going to be very, very busy this year with staycationers. Because I, for one, won't be taking my family on an aluminium tube to Greece this year at all, maybe not even next year. So staycations, I think, are the way forward this year. And it's fantastic news for the local economy as we hopefully begin to recover. And with that in mind, I want you to help us really, and probably not the right time to put in the chat to help here and now, but as we send out email afterwards, to see how we can help the hospitality and tourism sector, you guys, how we can help you. For example, I'll ask questions like, do you know what the benefits of the marketing scheme are? Could it be used to extend the holiday period into the autumn, maybe even longer? Will it be Christmas? Who knows? Would you like it to be used to market Devon to foreign visitors, or just UK visitors, or regional visitors? We want to know what you think. So I'll pretty much put some questions in to the email for you with some contact details and some web addresses, and have a look, and it'd be really, really useful if you get back to us and let us know how we can help you, because that's why we're here today. That's why we're all here today, to try and help you in your business. So thanks very much for your time. I appreciate that. Thank you, Helen.
Thank you, Jason. Yeah, I think it's a really important part of what we're all trying to achieve together. I think it's a good initiative and something that we need to support. Thanks, Jason, for that. I don't know if you've seen, panelists, but in the chat, Debbie Ball has just had an inquiry in her tea rooms for a baby shower inside for 14 people on June the 26th. If the roadmap goes according to plan, all social distancing should cease. Is that correct? Would that mean that I can put back tables in my dining room that had to be removed for social distancing purposes? Are you able to answer that, anybody?
I mean, I can pop in here. It's Sarah Jane. I think the indications are it could happen, but unfortunately none of us have got a crystal ball at the moment. I think this stage of the reopening and step 3 is quite an important step. You know, we all know that indoor people meeting together indoors is more likely to spread the virus, hence why they're talking about the ventilation, and we've been outdoors up until now. And really and truly, we'll have a picture in the next 3 weeks, 4 weeks, whether cases are going to start to rise again, or whether with the vaccination rates that we've got coming up, you know, that we are continuing to have the virus under control. So I don't think anybody, probably even the government at the moment, have a crystal ball enough that's going to be able to say what's going to happen on the 21st of June. And it's also particularly important that all the businesses work hard to the rules, and we're all use the common sense that the government have put their faith in to make sure that we help support the effort, and hopefully come the 21st of June we are in a good place and they can relax the rules further.
Yeah, as you say, nobody knows where we are now, but so I think the answer to that, Debbie, is just watch this space, really. Just keep, you know, following the links that you've been given on this event. Keep following the information, get all the guidance you can from Alistair and his team. Yeah, and keep on top of it. And I would say, actually, just leads me in nicely to closing this session off. Thanks once again to all our panelists, especially Alistair Handyside, Kerry Ross and Jason for putting this all together. Thank you for all your insights. It's been really, really helpful. It's helped me. I'm not in the tourism sector, although we do support, obviously a lot of members are in that sector. But yeah, it's definitely been an eye-opener for me. I've learned quite a bit myself. Thank you. So our next session is on Tuesday, the 1st of June, same time, same place. It will be chaired by my colleague, Stuart Elford, who's the CEO of Devon and Plymouth Chamber of Commerce. And we're going to be looking at any emerging problems that you're starting to encounter, discuss how you're getting on with the reopening, and obviously hope that you're going to be starting to thrive and find a really positive recovery for the beginning of this year. Thank you everybody for joining us. It's been my pleasure to chair and host this for you on behalf of Devon and Plymouth Chamber of Commerce, and on behalf of Devon County Council and all our other partners that you've seen mentioned. So thank you once again to our panelists, and we look forward to seeing you all again in a couple of weeks' time on the 1st of June.